Health news now, and World TB Day is going to be marked at the weekend, and an audit by the Treatment Action Campaign reveals that public clinics are doing very little to prevent the spread of the disease, and TB remains the leading cause of death in South Africa, claiming over 30,000 lives in 2015. I want to take you live now to Cape Town. Standing by to talk to Newsday is Dr. Mark Sonderup, the acting chairperson of the South African Medical Association. And by all accounts, and good afternoon to you, it would seem that in spite of efforts by some and none by others, we're not really winning this battle, are we?
No, Jeremy, I think we need to give credit where it's due. There are aspects to this battle that we as a country, in fact, are doing very well on. If you look at our diagnostic side of things, that is actually case finding aspect of combating tuberculosis, then we probably have one of the biggest programs in the world. A couple of years ago, you may recall, things changed, where we moved from the sort of age-old approach of checking someone's spit and doing a special stain and then waiting for culture, for example, which could take sometimes weeks to try and prove tuberculosis, to an automated system called Gene Expert, where basically with a single spit you can get a result within a couple of hours. And that actually not only tells you whether tuberculosis is present, but in fact tells you whether the TB is drug sensitive. And that has been a massive inflection point in the step forward towards picking up cases and rapidly getting people onto treatment. So from that point of view, I think we need to give credit where it's due. South Africa is at the cutting edge of using this technology. South Africa is also at the cutting edge of using new drugs in the treatment of tuberculosis. You will recall that there's been debate over the last few years, and you mentioned the TAC. They were actually at the forefront of in fact demanding new drugs for TB, and the drug in question was a drug called bedaquiline. That was registered now 2-3 years ago by the Medicines Control Council, and we've treated over 10,000 patients in South Africa with bedaquiline for pre-XDR and extensively drug-resistant tuberculosis, as well as multi-drug resistant tuberculosis, radically improving cure rates, for example. So on the diagnostics and treatment side, we are doing much better than we did in the past. In terms of new patients that are diagnosed with TB, drug-sensitive TB, we're still only getting a completion and cure rate of just under 80%. We should be hitting 85%. That's the WHO norm. But we're getting better. But you're quite correct. I think the flip side of it is prevention, because the only way you're going to tackle this issue is through prevention. And prevention comes in many forms. One of them, of course, is prevention within hospitals, within our clinics, for example, within our institutions, and then within communities. Now, within our institutions, for example, there, I think, is what the TAC is in fact referring to. We probably fall quite short, because our prevention, our means of doing that within our institutions and our public facilities is not great. In terms of community, we need to have better case finding and actually find people who've got undiagnosed DB and in fact treat them, because by getting them onto treatment quickly and rapidly, you make them less able to transmit their tuberculosis to another person. So in summary, I think we're doing well. There's a lot of work to be done. And World TB Day coming up on Saturday is a good time, in fact, to reflect. And this year, as you know, the call is really for leaders in this area. And I think that's a very apt moment for us to reflect upon that.
Let's talk a little bit about rural clinics, Dr. Sonderup, if we can. And again, one of the criticisms is that while progress has been made, and certainly, as you suggest, on the diagnostic side, when it comes to things like infection control at smaller rural clinics, that's where the problem is running away. Is that true?
Well, I think I would hesitate to say it's just a rural issue. I think it's an urban, peri-urban issue. It's a public health facility issue. We are heavily burdened by tuberculosis in South Africa, as you mentioned in your intro. It's one of the single biggest burdens of disease we have in South Africa, and of course driven very much by the HIV pandemic we have in South Africa, with just under 60% of patients with newly diagnosed TB, in fact, will be HIV positive. So that's the big driver. And of course, we are handling the HIV epidemic. We're doing well there. We always need to do better, and that will ultimately have an impact upon TB. But in terms of prevention within our institutions, it really is a resource issue. The kind of technologies one needs within facilities to prevent TB transmission are quite costly. I mean, there are very simple things one can do, like good ventilation and simply opening a window, for example, and having areas that are open and are well ventilated. But there are technologies such as UV lights, for example, and other technologies, and various types of flow of air that in fact are quite effective in reducing TB transmission. Jerry, that will cost money, and that's where the bugbear is. I mean, we are very constrained within the public sector. You'll well know the issues around austerity within the public sector, and it comes down to resource issues. So we need to kind of box smart. We also need to be a lot more sort of careful and more intelligent about our spatial planning within our facilities, where we put and house patients with tuberculosis, and try to minimize that risk. But bottom line, you're quite correct. We need greater access to resources.
Is there a gradual reduction, Dr. Sonderup, in terms of the stigma associated with this disease? In other words, are people now more willing to report, acknowledge, and seek treatment?
Yeah, I mean, I think that's a great question, and it's quite difficult to measure stigma. It's more of a subjective assessment of the situation. But my reading of the situation is that stigma probably is decreasing, and it's probably decreasing in tandem with what we've achieved with HIV, where we have been chipping away at that stigma issue over almost 2 or 3 decades now. So given issues around people being more likely to be open about their HIV diagnosis, what goes in tandem is people being able to share their diagnoses with respect to other diseases, and TB being one of them. I mean, it's something I think we always have to work at, and it's something as a society we must always remember. But by and large, if we've learned anything from HIV, we've learned the aspects of stigma and how to destigmatize. And I think we as a South African population and public have learned an enormous lot over the last 20 years. I mean, you'll recall a time when people with HIV wouldn't be touched by others. I mean, things have changed dramatically, and I think that's gone concomitantly with that is the approach to diseases such as TB as well.
World TB Day is acknowledged on, or at the weekend on Saturday in particular. Live in Cape Town for Newsday, Dr. Mark Sonderup, Acting Chairperson of the South African Medical Association. Thank you very much.